Welcome to Alphabyte, a digital system for accomplishing preformed zirconia crowns. We now have our workflow integrated within the Heron intraoral scanner software platform, and we will demonstrate its utility as it applies to restoring tooth B with a preformed zirconia crown from kinder crowns. We intend to roll out other features which help accomplish adjacent restorations, opposing restorations, potentially a full mouth of restorations, not just in pediatric but also in adult dentition applications as well. This is the Heron intraoral scanner. It functions like most intraoral scanners in terms of an optical digital impression system. Fortunately, we do not have to scan very many teeth, nor do we have to allow the computer to post-process and send the data anywhere, which saves significantly on procedural time. So in usually under 10 seconds, we can acquire enough data about the treatment tooth and a few neighboring teeth to allow our Alphabyte software module to run and pull up automatically from the Heron Clinic software. First thing we do is identify the treatment tooth, and the algorithm automatically cycles through all the libraries of digital crown forms and proposes the best fit digital crown, which corresponds to the crowns you have in your local library. The features allow the provider to adjust and modify the crown position and the crown size proposal per their discretion by simply rotating and dragging the arrows. Upsizing the yellow bounding box immediately automatically updates the crown size proposal, and in this case we've upsized to a DU 5.5 from the Kinder Crowns line of zirconia crowns. And in the bottom right panel we can picture the external crown form relative to the adjacent teeth, and in the upper right picture we can identify the tooth reduction requirements necessary to accomplish this particular crown size in this particular position. The color mapping indicates reduction requirements ranging from 2 millimeters in red through the orange down to the yellow, which is 0.5, all the way through blue, green, and purple, which indicate no reduction requirements necessary. Which is interesting because the first time ever we can now be much more conservative on our initial preparation approach, knowing that there are certain surfaces of this unprepared tooth that require zero preparation whatsoever. We can get very specific as to the reduction requirements by dragging the buccolingual and mesiodistal cross-sectional sliders across the tooth, but the color mapping should be intuitive enough to get you very, very close to ideal preparation form just by visual reference alone. So by having this cheat sheet that will guide your preparation attempt in the upper right, and having the crown proposal on the screen before you even start, now the first question is automatically answered. Which crown do I try in after I have prepared this tooth? Well, the computer program has already answered that question for us. In this case, it is a DU 5.5 from Kinder Crowns Universal line. And that crown can be pre-selected and set aside by your assistant before you even begin the procedure. And by looking at the color mapping and the cheat sheet for preparation, perhaps we can nail this preparation the first time, and that pre-selected crown fits perfectly on the first attempt. And now perhaps we have accomplished a pediatric zirconia crown faster than we ever could a stainless steel. But more often than not, especially as you begin this process, you're likely to leave an area of under-reduction, and exactly what is causing this crown to bind and not fully seat is a completely subjective situation, usually something corrected by experience alone. No longer is that the case, because simply by using the scanner, passing it over your initial preparation attempt, and rerunning the automated algorithm that analyzed the preparation form, in mere seconds we can pre-answer those gut-level questions that were ordinarily blindly refining this tooth circumferentially. Now we can see exactly where the tooth is under-reduced and what is causing the binding when we attempt to seat that pre-selected crown. No longer are we confused as to is it a crown selection problem or a tooth preparation problem. Now we know 100% that it is a tooth preparation under-reduction and exactly where that under-reduction is occurring, in this case on the mesiobuccal and distal lingual. It's as if your professors from dental school were to mark up your initial preparation attempt with yellow, orange, and red highlighters and show you exactly where you have messed up, exactly where this tooth requires further reduction to receive that ideally selected crown size. So no longer do we have to blindly go back and refine these preparations, further risking secondary pulpotomies and over-reducing certain areas. No longer are we confused as to have we selected the right crown in the first place. So we can go back in and refine our preparations and retry the crown, and if it fits, we're done. But perhaps before we try the crown in, we can analyze our preparation one more time and pre-validate that our preparation refinement has accomplished the goal. As many of us know that have tried in zirconia crowns, sometimes they break due to their inflexibility, and that costs us not just money but additional time. And if we pre-validate our preparations and achieve this visual passivity, we can go back into physical crown try-in mode with a lot more confidence that we will achieve that proper fit and good retention and resistance form by still having a mind for conservative tooth preparation, but also a mind for efficiency and proper crown placement. So seeing that this is all green and blue ensures that our crown should go into place, and in this case it does. We have an ideal crown size selection and an ideal preparation form that is still done so conservatively, and we have not had to question the initial crown size we selected for try-on the very first time. So in this case, we can now accomplish even single teeth as efficiently in zirconia as we could with stainless steel. And maybe it's an academic exercise, but of those of us that want to be more trusting of the computer guidance here, we can go back in and scan the post-cementation crown position and reanalyze how well we stayed true to the digital proposals. So in the bottom right corner, you see the right digital proposal crown superimposed with the gray surface of the post-cementation crown position, and we can be very, very sure that we were able to achieve that pre-proposed position with that pre-proposed crown size, and that pre-proposed preparation form allowed us to do that by following the visual guidance all along the way. So in this, we hope that we can offer highly desirable, more durable, more biologically compatible, and aesthetic zirconia alternatives to stainless steel crowns for every patient in need.